Welcome and thank you for joining me. My name is Solange Patarroyo. I am a health educator for Community Health and Atlantic Health System. Today, the webinar Caring for the Caregiver is presented by Robin Ennis, Caregiver Resource and Information Specialist.
Thank you very much for having me today. I'm going to share screen. So good morning or good afternoon. My name is Robin Ennis, and I am a Caregiver Resource and Information Specialist. And I'm here to talk to you today about unpaid caregiving. So let's start with, are you a caregiver? Do you provide care for an aging parent, a spouse, a sibling, a friend, or neighbor, or a child with special needs? If you've answered yes, then you are a caregiver. Do you care for anyone with a mental illness, a physical or developmental disability? If you've answered yes, you are a caregiver. Do you run errands such as picking up medication or groceries? Do you make meals or provide help with daily care or paying bills? Do you drive to or assist with scheduling doctor's appointments? Again, if you answered yes, you are a caregiver. You could be caregiving for someone who's aging, someone with a disability, or someone with a mental health challenge. Oftentimes, family caregivers or unpaid caregivers do not identify as such because they view themselves as just being the child taking care of the parent, or the parent taking care of a child, a sibling, a friend. As I said, it could be a neighbor. So let's talk about the definition of a caregiver. So a caregiver is an unpaid family member, friend, neighbor, coworker, etc. It could be a full-time, part-time, or long-distance caregiving. You could become a caregiver over time, or you could become a caregiver overnight. It could be you are doing occasional check-ins, or phone calls, or visits, or it could be total personal care. So there's many levels of caregiving. I want to read a quote from former First Lady Rosalind Carter. She says there are 4 kinds of people: those who are caregivers, those who will be caregivers, those who have been caregivers, and those who will need care. That is so true. So I'm going to continue with what is the definition of a caregiver. You become an instant expert in a lot of things. So advocacy, you may be advocating for the person that you're caring for, trying to get them services and supports, perhaps signing them up for Medicaid, perhaps helping them transition into a long-term care type of lifestyle, assisted living or nursing home. You may be advocating for them to get the right health care, to get the right diagnosis, to get the right treatment for whatever the diagnosis may be. So you become an advocate, not only for yourself as a caregiver, but for the person you're caring for. Emotional support. This is super important. The caregiver needs emotional support also. We often think as a caregiver, we're providing the emotional support to the person that we're caring for, but who's helping the caregiver with their emotional support? And that's very important because self-care is something we'll talk about a little bit into the program, but self-care is part of emotional support. Finances, you become an instant expert often in the finances of the person you're caring for. You need to make sure that their bills are being paid, that you're reviewing their explanation of benefits to be sure that they're not paying for something that they shouldn't be. You're managing their finances. Maybe now you're not writing checks for everything for them, but you've set things up online to be auto paid. You're making sure that there's no funny business going on with their bank account, right? A lot of scams going on right now. So you want to make certain that their bank accounts are kept safe. And perhaps they're unable to manage their own finances any longer. So you need to be sure that you've taken that control away from them if they can't be responsible for taking care of their money and not falling into scams. Unfortunately, too many people do fall for a lot of the scams that are going around. Insurance and benefits, making sure that during the open enrollment period that their Medicare plan that they're currently signed up for is still adequate based on maybe new diagnosis or new treatments that are taking place. And again, their prescription drug plan, their Part D, Medicare Part D plan, making sure that it's still appropriate for the type of medication that they may now be on. And also making sure that maybe there's life insurance policies that need to be paid quarterly or annually. Being sure that if they're still driving, that their automobile insurance is kept up to date. And just being that support system for them as they continue to need your care, and identifying when they're not able to take care of these things any longer, because it's really important that they're kept safe from all of the things that could happen if, let's say, they're still driving and their car insurance lapse and there's an accident, or they are not in the right Medicare plan and all of a sudden the medical bills begin to pile up and their finances begin to deplete. Legal documents. Legal documents are something that a lot of folks don't address. Certainly, if you have a will, it's a good idea every couple of years to review the contents to be sure that they're still appropriate. If you don't have a will, certainly something to be considered. You may not have a power of attorney, but there comes a time when you may need one. So you want to have a power of attorney put in place. You may not have a living will, but it's as perhaps your disease progresses, if you have a diagnosis, a specific diagnosis, you may decide that a living will is something that you would like to at least learn more about. And 5 wishes, I don't know whether anyone is familiar with 5 wishes, but 5 wishes is a great document. It helps you lay out what you want in your final days. It could be, what song do you want played at your memorial service? Medical information and treatment, you become an instant expert in someone else's medical information and treatment. You're an expert in your own, or at least you're taking care of your own, hopefully. But you also now may be held responsible for taking care of the person that you're caring for with their medical information and treatment. And that can open up a whole huge learning experience. I always tell folks, it's good to have a notebook handy, one notebook where you keep all of the notes for their medical information and treatment. Being sure that you understand it, and perhaps if they're still cognitively able, that they understand it. If they're not, and they have a diagnosis such as a dementia or Alzheimer's, then it may fall all on your shoulders in terms of knowing what their medical information and treatment plans are. Constructing a plan. So this is super important because often caregiving comes out of nowhere, right? Sometimes it could be your loved one has had an accident or a health issue, and now it's been identified that they really are not safe going home to their own home. So they may have to come and live with you, or you may have to have considerations like going into a long-term care environment. They may be able to go back to their own home, but they may not be able to be there alone. You may need to put some home health aides in place. You may need to start looking at respite stays. So those are all things to be considered. And when you're constructing the plan, you want to think about, what is that plan going to look like going forward? You want to recognize your challenges. What kind of challenges am I faced with now in this new caregiving role? Or maybe the role is not new to you, but it's changing because the diagnosis is changing. The disease is progressing, whatever that might be. It could be Parkinson's, MS, dementia. It could be heart disease. We see an awful lot of that these days. So recognizing your challenges, identifying your support networks. This is really important for the caregiver, because you need support when you're in the role of a caregiver. It's a job we didn't ask for. It's often a job we're not trained for. It's a job that we're not getting paid for. but it's a job that we have to do. And we can't quit because we're a caregiver and we're needed by the person we're taking care of. So you need some support systems as a caregiver. So I say the support systems look different for each individual caregiving role. So thinking about what that would look like for you and then reaching out to someone that can help you get connected and find those supports. Learning. Education is very powerful. Education empowers you. It gives you confidence, it gives you motivation, and it certainly is helpful when you're accompanying the person you're taking care of to a medical appointment to have some knowledge around what they're going through. Assemble your team. This is really important. So in identifying family, friends, folks from your church, and folks in the community that can be on your team. So I always use this example. So you've identified that Mary and Sally are willing and able to be on your team as volunteers to help out when you need them. So it comes a point in time where you say, you know, I still really enjoy cooking, but this caregiving is taking up a lot of my time, and I really need someone to assist me with cooking. So you look at your two volunteer team members, Mary and Sally, and you say, okay, Mary, she doesn't really like to cook. She really doesn't enjoy food. I don't think Mary would be the person that you would ask to cook for you. Sally, on the other hand, Sally loves to cook. She loves to bake. She always has enjoyed it, and she really enjoys food. She may be a better fit for making you a meal. Mary, on the other hand, really enjoys hopping in the car and taking a ride, running errands for folks, doing a little grocery shopping, picking up some medication. Maybe Mary would want to accompany your loved one to a doctor's appointment. Mary could be the driver. Some considerations would be if there are ambulatory issues, perhaps there's a wheelchair needed for the person you're caring for, or a walker. Be sure that the Mary is capable of getting the wheelchair out of the trunk or the back seat, getting it open correctly and safely, and transporting your loved one into the medical appointment. It's always good to also consider, if you're sending someone to a medical appointment with your loved one, are they a good person that's going to really listen to what the doctor's saying and be an advocate for the person that they're accompanying, the person that you're caring for? I also say to caregivers, please don't cancel your own appointments. If there's an overlap in appointments, you've got one on the same day that your loved one has one, please consider having a volunteer take your loved one to the doctor so you can continue your appointment. Self-care, again, super important, and part of that is keeping your medical appointments and taking care of yourself. The medical team. Medical team can consist of a lot of different people, right? It depends on how many specialists someone has. It could be your primary care physician, your PCP. It could be a cardiologist, an endocrinologist. It could be a nephrologist, geriatrician, cardiology, pulmonology, right? We've got all those different ones out there, but it can also be your physical therapist, your occupational therapist, perhaps a dietitian or nutritionist, a dentist, ophthalmologist. So we've got a lot of different specialists that we all see. So I think it's really important to assemble your medical team, know who they are. You're part of that team as a caregiver, and certainly the care recipient as the patient is also part of that team. Something also to keep in mind is you can fire your physician. If you have a physician that you feel is not on the same page as you and or the person you're caring for, and you don't have a mutually beneficial relationship with that physician, it's okay to seek a different physician, a specialist. You don't have to keep the one that you're not happy with. And they may not be listening to you when you're at your medical appointment. They may not be listening to the person that you're caring for. And I also say, if the person you're caring for is able to speak for themselves, let them at the doctor's appointment. Don't speak for them, and request, if the medical professionals are not addressing the person you're caring for directly and they're still capable of being addressed directly, ask the healthcare provider to direct their questions and comments directly to the patient who is the person you're caring for. Preparing for the visit. I encourage folks to make a list of what your questions and concerns are prior to your visit. It makes it that much more productive at the visit. I also suggest getting there early. Arrive 5 or 10 minutes early. Give yourself a little breathing room. You never know what traffic is going to be like. You never know what parking is going to be like. You can get inside, take a deep breath, and unwind a few minutes before you're called into the appointment. And when you're in the appointment, if you have let's say it's you're caregiving for your parent and your brother, I'm taking my mom to the doctor, but my brother can't make it and he wants to know what's going on also. There's been a change in her condition. It's okay to ask the healthcare provider or let them know that I'm going to call my brother and I'm going to put him on speakerphone so he can hear what's going on during this appointment. It's okay to ask that. It's also okay to say that you're going to record the conversation during the appointment because you need to share it with the rest of the folks that take part in caregiving for your loved one. Services and social connections. Services can be virtual education programs, such as webinars like we're here today doing. I do a monthly caregiver timeout group virtually that is a caregiver education program. Services could be the senior centers in your local communities. It could be your Division of Aging and Disability Services in most counties in New Jersey have senior nutrition and education and exercise sites. Warren County specifically has 4 of them. It could be support groups, church groups. It could be a respite stay. Services could include a respite stay. So you would have the New Jersey statewide respite care program is available to folks that are eligible, and it can allow you a minimum of 7 days of a respite, whether it be in your own home where someone is coming in and taking care of your loved one so that you as a caregiver can take care of things, maybe make your own medical appointments. It may be that you want to go pay a visit to a family member, or you want to take a day away and shop with a friend. The respite works for both caregiver and care recipient. Someone is there to take care of the person you're caring for, which allows you as the caregiver to take care of yourself. Social connections, they're very important too, right? We all need purpose, and sometimes it's just having that friend or social outlet. So it could be a book club, it could be YMCA programs, could be library workshops and seminars. It could be a crossword puzzle group or Sudoku group. There's a lot of different social connections. Could be a friendly visitor. A lot of the county offices on aging have programs of volunteers that pay a friendly visit to folks. Sit down and talk with them, do a puzzle, watch a favorite movie together. And oftentimes those relationships are very beneficial to the person who you're caring for, as well as you as the caregiver. It gives you a little bit of a break as well. Resources and starting points. So when you become a caregiver, as I said, it's a job you didn't expect to get. It's difficult. It's very difficult. Caregiving is by far the most difficult job that I've ever done. You don't often know where to start. So resources and starting points. I consider myself a starting point for caregivers. I've been doing this work for almost 16 years, and I have a lot of really great relationships in a lot of communities, a lot of the counties here. Specifically, I've worked in Warren County for a really long time. I actually used to work for their Division of Aging and Disability Services. I'm still very connected with them. I am a service provider for them. But I'm also very familiar with the counties that surround Warren County. So I have a lot of relationships and a lot of resources available to me. The New Jersey Aging and Disability Resource Connection, known as the ADRC, every county in the state of New Jersey has one. There is a toll-free phone number here, or, oops, I'm so sorry. Or every county has a local number, and I can certainly provide that to you for the county in which you or your loved one lives in, to help you get connected with them if indeed you're caregiving for someone who's aging or has a disability. New Jersey 211, they're a very helpful phone call away. A lot of folks that may be facing eviction or homelessness or difficulty paying utility bills, require transportation to medical appointments or even to just the grocery store, meals, all different programs. They're very much a good resource for connecting with different services available within the community. There's also National Alliance of Mental Illness. I don't have that listed on the slide, but they're a great resource as well. I believe every county in New Jersey has a NAMI, National Alliance for Mental Illness, and I can certainly connect you with the local offices of any of those. So how can I assist you? I can assist you in a lot of ways. Every caregiver experience is very unique, so it's really dependent upon the needs. And certainly we want to identify what those needs are, talk through that. I ask caregivers to, when we first strike a conversation, whether it be by phone, in person, through email, text messaging, whatever works, I ask that they paint me a picture of a day in a life of their caregiving responsibilities. What does it look like for them? A little bit about what the care recipient's needs are. Actually, we talk a lot about what the care recipient's needs are. Caregiver burnout is real. And unfortunately, a lot of times caregivers wait too long to talk with me and get connected. And they're frustrated. They feel like they've hit a brick wall. Nothing's available. I can't find anything. I don't even know what I need. That's often what happens. You don't know what you need until the time comes, right? You don't think about, well, let's think about what I'm going to need when I become a caregiver. You don't think about becoming a caregiver. It just ends up in your lap. So I can assist you with access to resources, education, information, services, and support to sustain you in your caregiving role. As I said, after we talk and we identify what the needs are, then we start to plug into what's already available in your community. With your permission, I would add you to my mailing list, and you would receive a monthly newsletter called Ramblings by Robin, Scoop for Caregivers. It's a monthly newsletter that has information. I've divided it out by aging, disabilities, mental health, veterans, general. There's date-specific events. As a matter of fact, I do list a lot of the Atlantic Health System events that they host throughout their demographic. There's a lot of different resources. It's pages and pages. It's become very valuable to providers as well, because they use that to be able to connect some of their patients or clients or consumers to services in the community. I offer in-person and virtual education programs on a variety of topics provided by subject matter experts. These topics are chosen based on what our caregivers are telling us they need more information around. I have been hosting this for 4.5 years with a friend and colleague who is a dementia consultant. She's an expert in the field of dementia. So we do a lot of offline connections also through that program. I offer biannual in-person caregiver conferences. I hosted my first one at Atlantic Health Hackettstown back in April. They were kind enough to host me. They're actually hosting me again in April of 2025. We had three great presentations. We filled the room. We were at maximum capacity, and the caregivers definitely benefited from the in-person conference. My second one will be held in September at St. Luke's University Health Network in Phillipsburg. And I again will have three speakers. We always end our conference, I always end the conference with a more of a self-care program, whether it be just a quick breathing exercise, maybe some chair yoga poses that can help to de-escalate a caregiver when they're frustrated, right? Because like we said, it's a very difficult job. I offer monthly in-person caregiver support groups. I do this with a colleague and friend, Dr. Frank Gilly, who's a retired geriatrician here in Warren County. And our first one is being held August 6th. I will be holding these at the libraries that are part of the Warren County Library System. If you want more information, you can certainly reach out to me. I offer assistance with navigating through the challenging decisions and problem solving. So challenging decisions, it could be, I'm thinking it's time that I consider long-term care for my loved one, or is hospice care something that I should be thinking about, or is it palliative care? I'm really considering moving my loved one in with me. I think my loved one maybe needs some home health care at home. I don't think my loved one should be driving any longer. Those are all challenging decisions. So I help you through those, and we come up with problem-solving techniques to get through them with a minimum of stress and anxiety to both the caregiver and the care recipient. And every caregiving role is unique, right? As we said. So what may be effective in one situation may not work at all in another. So we have to get creative sometimes, and together we do that. I offer meaningful connections with other caregivers. This is so valuable. Caregivers get how hard the job is and how frustrating it is. It's always great to connect caregivers with one another so that they can support each other through similar situations. They're not the same situations, but they're similar. So if you're caregiving for someone with dementia and you're just really frustrated with the day-to-day challenge of caregiving for someone with cognitive decline, it's always nice to have someone else in your court who understands what you're going through in terms of that specific disease. So I try to connect caregivers to provide each other with support. I provide support along your entire caregiver journey, and that caregiving journey can take a lot of twists and turns. Sometimes the person that you're caring for may only need your care short term because they had, let's say, a cardiac issue and they needed you for a short period after they were discharged from the hospital or rehabilitation center. That's great. So your caregiving role was pretty short-lived, but then maybe someone else in the family needs you as a caregiver, or the person that you were caring for before that got better and was maintaining on their own, something else has come up and now you're back to caregiving for them again. So it's the entire journey. Sometimes I hear from a caregiver and we get things all straightened out and I don't hear from them for a year or two. And sometimes I have a caregiver who I talk to weekly and sometimes monthly. And in the beginning, sometimes daily if needed. I'm not going to take a lot of time on this, but caregiver facts and stats, this is super important. Caregiving is a universal reality that touches almost every family. And as the poll showed at the beginning, the majority of caregivers are in fact women. Caregiving is often assumed without preparation or education, and it's often to the detriment of the caregiver's own well-being. So oftentimes caregivers are forced to give up a promotion at their workplace. They may have to go down to part-time status, so that affects them financially also. They may have to give up working altogether to take care of the person they're caring for if the need is that great. That's a financial burden to the caregiver, not just on an income level, but on a future level in terms of their savings for their future, for their retirement. So there's implications on the caregiver that can run very deep and become a very different picture for the caregiver for their future. Caregivers are the backbone of long-term care in America. There's no doubt. Everyone should be very grateful for those that are caregiving because they take a lot of burden off of the healthcare system and the long-term care system. Caregiving can also be a great risk, right? Your own physical health, emotional health, your mental health, right? That becomes very challenged at times, in addition to the financial health. Family caregivers provide an invaluable resource to their loved ones. As I said, backbone of the long-term care system of America. You're doing it because you care for that person, whether it be a family member or a friend or a neighbor. You care for them, so you recognize that you need to help them through the journey that they're on, and you are now their caregiver. And you provide such an invaluable resource to them because you're allowing them to stay in their home in most cases, right? Where if someone weren't there to help them, they would be forced to go into a long-term care setting where they could be taken care of by paid staff. Caregivers are often isolated and overwhelmed and report not knowing where to turn for help. I can relate to this. My oldest daughter at the age of 2 was diagnosed with a terminal illness. I had to quit working, which I loved my job, and I had to give that up. So I lost that purpose. I had an infant also. My youngest was just an infant, and my husband had to keep his job. We needed medical insurance and an income. Young parents, just bought a home. I felt so isolated. My friends didn't know what to do to help us, so they stayed away. And when they would offer to help, I would push them away because I honestly didn't know what kind of help I needed. Once I started to talk to professionals and recognize that they were trying to help me and that I could use their help, desperately could use their help, I started to feel less isolated and less overwhelmed. But I will tell you, it took me close to 12 months to recognize that I really was isolated and overwhelmed. And I didn't know where to turn for help until I really got connected with the social worker at the hospital. And then I started to really recognize that there were services available to me and that I really needed to start tapping into them. Sometimes that's difficult also, right? Because you are told, okay, you may be eligible for Medicaid or the JAC program if you're a senior, the Jersey Assistance for Community Caregivers. You may be eligible for those things, but there's an application that has to be completed in order to see if you are eligible and enroll in the program. Sometimes caregivers say, I just don't have time, or this is too overwhelming for me. There are people that can help with those things. So don't take that stack of papers and just stick it on the dining room table under a placemat. Reach out to me and I will connect you with the folks that can help you, because those are the kind of services that may be helpful to you and take some of that burden off of you as a caregiver. 90% of caregivers say they worry more and feel more stress. That's pretty accurate. Caregivers worry more in part because they worry about what will happen if something happens to me. Who will take care of the person I'm caring for? This is why self-care for caregivers is so important. They feel more stressed. Caregiving is super stressful. There's nothing easy about caregiving. So no wonder they feel more stressed. But again, that's where self-care comes into play. Maybe it's taking a walk for a few minutes. If you have a friendly visitor coming in once a week, take advantage of the time that you have. Maybe it's just taking a little bit longer in the shower, catching up on your own bills, reading that email that came in from a friend sharing their life with you, but you haven't had time to read it. Could be any of those things. It could be just going into a quiet room and sitting quietly by yourself for a period of time, going to have a cup of coffee with a friend, taking a ride in the car, walking the dog, whatever is good for you to keep your stress level at a minimum when you have an opportunity. And this statistic is quite alarming. In 2023, the National Alliance for Caregiving estimates 65.7 million Americans, or 29% of the US adult population, involving 31% of all US households, served as family caregivers for an ill or disabled relative. That's just unbelievably such a large number. So my commitment to caregivers, I meet caregivers where they are in the stages of caregiving. And as I said before, you could just be starting out as a caregiver. You may have been, and now you had a break, but you're back to it, and it may be back to it with the same person that you took you had the break from, or it could be someone entirely different. Oftentimes, I have caregivers that are caregiving for multiple people. You could be caregiving for your mother who's aging and has some complications or diagnosis that she needs your help. And you could also be caregiving for a child or a grandchild that has special needs. So often my caregivers are not just caregiving for one person, and they're forgetting to take care of themselves. My friend and I always say self-care is not a luxury, it is a necessity. And we have to always remember that as caregivers. I recognize that each caregiver experience is unique, yet many share common experiences. And as I said before, that's where I try to connect the caregivers with each other for that support. Although each experience is very unique, oftentimes there's that commonality. I meet the diverse needs of each caregiver based on their unique caregiving experience. There's a lot of needs. We have to talk about what they are, and then we have to, in order to identify them, and then we have to address how do we get through them? How do we manage them? What can we do? Do we need resources? Do we need support, service connections? What is it that we need? We work together on that as a team. I help caregivers identify their needs and connect them to the resources, support, services, information, and education, as I said. I support self-care for caregivers. Again, I can't say enough. Self-care is so important. I had a caregiver call me the other day and say, I have a medical situation. I'm going to be admitted to the hospital for some pretty major surgery next Tuesday. I cannot leave my father alone. What am I to do? So we worked together very quickly and we got a respite stay for her dad. Her dad really is one step from needing an assisted living facility and even perhaps long-term care, nursing home care. We're hopeful that assisted living could be the first step. A respite stay is a great opportunity, and this daughter is seeing this now. Her dad is going to be in an assisted living for a week on a respite stay, so he can get an idea of what it's like to live in an assisted living, and she can get an idea of, would that be a good place for my dad? If all goes well, she is considering keeping dad at that assisted living as his new home. So a respite stay is kind of a dry trial run, if you will, to see how your loved one would like to live in that type of environment, and how do you feel about the care that that person's getting within that environment. So I work together with my caregivers as a team. I want to say thank you very much for having me today, and I hope that you got some takeaways from today's presentation.
So we appreciate you join us today. We can ask you to take a few minutes after today's webinar to complete the program survey. The link to the survey is also added to the chat for convenience. And a special thank you for Robin Ennis for dedicating your time and expertise today. If you have additional questions or comments, send an email to communityhealth@atlantichealth.org or call us at 1-844-472-8499, option 3. With this, conclude our webinar, and thank you everyone for enjoying us today.
Thank you for having me.
No, thank you.